Poornima Srinivas from Hills Dental Design. I'm the founder and owner of Hills Dental Design. Today's topic, basically, we wanted to talk about guided surgery. What is guided surgery? So I've been actually posting Facebook Lives, a series of Facebook Lives. We talk about implants. So we said, are you a good candidate for implant? What are the diagnostics which we are going to do? For example, the CBCT and the oral scan. And then how we merge the diagnostics together, which means how are we going to merge the CBCT, which is a 3D X-ray, and the oral scan so that we can design your implant placement. Now that we know where we are going to design and we've both agreed as to how many implants we're going to go ahead, what we would like to offer is a fully guided surgery. So today's topic is, what is a guided surgery? So guided surgery means that we have taken all the information from the CBCT and the oral scan, and then we can actually print a 3D stent. Now this is how it's going to look. So that's a 3D stent there. So what it does is basically we print it out from a 3D printer. We don't do it, it's actually outsourced. The reason for that is it actually sits very, very snug on the missing space. So this is the missing space. This is where we want to do the surgery. And then we actually fit that in. What does it mean to you for a patient? For a patient, what it means is that there is no cutting, there is no bleeding, and there is no pain. That's it. That's why we would love to have guided surgery. And for the practitioner, it is the accuracy of the treatment. So that's because we're using the digital technology that we know, okay, this is where it's going. It's calibrated to the micromillimeters. So then we know that this is where exactly the implant is going to be placed. So what's the difference between guided and non-guided surgery? So say, for example, I had nothing, there's no guide there. And we say, well, what we need to do is we need to just do the implant. Now there are two implants here and one implant on this side. So for the one implant here, I would have then had to open up a flap. I had to cut the gum, open it so I could visually see. I mean, of course, we had a 3D scan before a CBCT, but manually I had to eyeball it and say, okay, there is enough bone, so visually see there is bone. Then I actually drill, and then I put a cover screw, and then I stitch it up all over again. So obviously, every time we stitch or every time we cut, that's when the inflammation happens. So that's when the patients experience pain. And then the stitch may have to be removed in 10 days time, or nowadays we just use a resorbable stitch. So obviously for the patient, it's so much more because they're coming in, we are cutting, we are opening. And also from an infection point of view, we don't want the body to be exposed to the outside environment as much as possible. So what we are doing with the guided surgery is literally punch through. So it's called like a keyhole surgery or a punch through surgery, and that's only possible because that's exactly where the hole is, and we say, okay, this is where we are going to place the implant. Okay, and from a clinician's point of view, it's clean as well, so there is nothing, there is no blood, there's no cutting, and also it's quite a faster turnaround time for both parties. So it's, for me, it normally takes around 30 minutes to place one implant under guided surgery. And so look at this again. So what we do is we go through a series of drills right through where we have the opening there, but we know exactly that's what's going on. And in the final step, we do take an X-ray to make sure we are happy with the implant placement. And when you walk out of the practice, you're just going to walk out like this. So see that blue thing sticking out? That's exactly what it is. And there's no bleeding, there is no stitches. This exactly looks like that. And also from a care point of view, it's so much more easier for the patient because there's no opening, there is no stitching, and the recovery is really quick. However, there are cases where we can't do guided surgeries, and we will talk about it in another Facebook Live. So for the next Facebook Live, what I'm going to do is I'm going to talk about when we can't do a guided surgery. Okay, so let's just talk about that at the next Facebook Live. Now, thank you so much for listening. I hope this was useful. Now, this is Dr. Poornima Srinivas from Hills Dental Design, where healthy and beautiful smiles begin. Now, we are offering a free implant consultation. So, if you would like to take, if you would like to take that offer, please call the practice on 94841913 so that we can help you to make the right decision. Thank you. Take care. Bye bye.